Part A. Extract 1. Questions 1 to 12. You hear a gynecologist talking to a patient called Mihira. You now have 30 seconds to look at the notes. Good morning, Mihira. Please come in and take a seat. How are you feeling today?
Good morning, Dr. Cox. Well, honestly, I've been feeling a bit uneasy lately. I've been experiencing some pain in the lower abdomen for the last few days, and I'm not sure.
I see. It can sometimes be a concern during pregnancy. Let's go through your symptoms in detail.
Doctor, it started as a dull ache, but lately, it's become more intense, especially when I'm walking or standing for long periods. It's quite uncomfortable, and I'm worried it could be affecting the baby. I've also noticed some swelling in my ankles and feet.
I understand why you're concerned. Swelling, particularly in the feet and ankles, can be a common symptom, but you mentioned the pain becomes more intense with activity. Do you experience any discomfort when lying down or resting?
Not so much when I'm resting, but I'm constantly tired. And recently, I've started having difficulty breathing at times, especially in the evenings.
These can also be common around the 6-month mark, but given your symptoms, I want to make sure we're not missing anything more serious. Have you tried any treatments or remedies to alleviate the pain or swelling?
Yes, I've been trying to rest more and elevate the feet, but it hasn't helped much. I've also taken some paracetamol, but I'm hesitant to take any stronger painkillers. I don't want to harm the baby.
You're right to be cautious with medications during pregnancy. Paracetamol is generally safe, but stronger pain relief would only be prescribed if necessary. Have you noticed any other symptoms?
Actually, I did have a pretty bad headache yesterday, but I thought it was just due to stress. As for the baby's movements, they seem to be normal, but sometimes I feel a bit anxious about whether the baby is okay.
Alright, Mihira, from what you've told me, it sounds like we need to be vigilant about a few things. First, the pain and swelling could be related to normal pregnancy changes, but the combination of swelling, headaches, and shortness of breath raises some red flags. I'm particularly concerned about the possibility of preeclampsia, which can develop in the second half of pregnancy.
Oh, I've heard of that. Isn't it related to high blood pressure?
Exactly, if left untreated, it can be dangerous for both you and the baby. That's why we'll need to run some tests to check your blood pressure and screen for proteinuria, which can be a sign of it.
Okay. What kind of tests will I need to undergo?
We'll start with a blood pressure check and a urine test to look for protein. I'll also recommend a blood test to check for liver and kidney function. Additionally, we'll need to perform an ultrasound scan to check on the baby's growth and amniotic fluid levels. If everything looks fine, we'll monitor you closely, but if we detect any signs of the condition, we'll need to take action immediately.
What kind of treatment would I need?
The primary treatment is managing your blood pressure. We might prescribe antihypertensive medication, nifedipine, which is safe to take during pregnancy. You would also need more frequent monitoring. This might mean coming in for checkups once a week or even more often if necessary. In some cases, if the condition worsens and it's too risky to continue the pregnancy, we may consider delivering the baby early, but that's a last resort.
I see. That's a lot to take in. What's the next step?
For now, we'll proceed with the tests I mentioned.
Extract 2. Questions 13 to 24. You hear a nurse talking to a patient called Mihira. You now have 30 seconds to look at the notes. Hi Mihira, I'm Nurse Robin Green. How can I assist you today?
Hi. Yes, thanks for seeing me. I'm really worried about my knee. I fell, it was about 3 days ago, I think. Yes, 3 days ago. I was at home, and I slipped in the kitchen. Landed pretty hard on the right knee, you know? It swelled up immediately, and, I didn't think much of it at first, but now it's gotten worse. I mean, much worse. It's really swollen, it's like a balloon or something.
Alright, how's the pain? Does it hurt when you move it?
Oh, yes, it hurts. It sort of throbs around the back, and then it's like this sharp pain right in the front of the knee. The front and back, but mostly the front. And then sometimes, I can't really bend it, you know? Like, it's very stiff. But what's really strange is, it feels like, I don't know, like it's clicking inside. Yeah, like a clicking or, maybe it's grinding? I don't know the right word.
I see. And this pain, does it get worse at certain times? Or when you're doing specific activities, maybe?
Well, it's worse when I try to stand up, for sure. Like, if I've been sitting for a while and then I try to get up, I can barely stand. It's almost like my knee just gives out, like it can't support me. And, going up the stairs is impossible. I have to hold on to the railing, and even then it's, painful. But it also aches when I'm just resting. Like, if I'm in bed, it throbs, and I feel this heat.
Heat can indicate inflammation. We'll need to investigate. So, have you tried any treatments so far? Have you done anything to reduce the swelling or manage the pain?
Well, I did the usual. I put ice on it the first day, right after it swelled up. You know, the RC thing, rest, ice, compression, elevation, but, I'm not sure if I did it right. I mean, I kept the ice on for, about 20 minutes each time, maybe? But, it didn't really help. I also, I've been using this cream, Voltaren. My friend gave it to me. But the swelling hasn't gone down at all. And I took some ibuprofen, but I can't really say if it's helping. Maybe a little?
Okay, so you've tried remedies, but it's still swollen and painful. Any other treatments you've tried?
I also wrapped it in an elastic bandage. That was, on the second day. It felt a bit better at first, but then the knee, it felt too tight, you know? So I took it off. Oh, and I've been elevating it, but no real change, honestly.
Aha. Has there been any bruising, or do you notice any instability when you walk?
Bruising? No. Well, I don't think so, at least. It's hard to tell, because, the knee is still so swollen, but I don't see any bruises. As for walking, like I said, it's really hard. It feels like my knee might give way any second when I put weight on it. I've been limping a lot.
Understood. Have you had any past knee injuries or fractures before this?
No, I've never hurt my knee before. But, I do have arthritis in my hands if that's relevant. My GP put me on naproxen for it about, 6 months ago. And I've had, a few back problems, but that was ages ago.
Given what you've described, we should do some tests to assess the extent of the injury. I'd like to arrange an X-ray of the knee to check for any fractures or structural damage. We may also need an MRI if the X-ray doesn't give us enough detail, especially since you're feeling that clicking sensation.
Oh, do you think it could be a fracture? I really hope it's not something serious.
It's hard to say without the tests, but the swelling, instability, and difficulty bearing weight could indicate a ligament injury. We'll know more after the X-ray. We'll likely prescribe corticosteroids, depending on the results of your tests.
All right, I'll do that. I'm really worried. Hopefully, it's nothing too serious.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen.
Now look at question 25. You hear a nurse called Mihira talking to a doctor. Now read the question. Mihira, I need you to be mindful of Mr. Ralph's cultural beliefs regarding medication. He's expressed concerns about the potential side effects of certain drugs, and he prefers natural remedies. We need to respect his beliefs while ensuring his medical needs are met. Explore alternative treatment options, such as herbal supplements or acupuncture, in conjunction with conventional medicine.
I understand. I'll schedule a meeting with a cultural liaison to gain a deeper understanding of his beliefs.
That's a good idea, Mihira. Involve him in the decision-making process as much as possible. Open communication is key to building trust and ensuring adherence to the treatment plan.
Now look at question 26. You hear a doctor talking to a patient's carer called Mihira. Now read the question.
Mrs. Mihira, thank you for coming in. Let's discuss your husband's condition. The MRI results confirm a mild concussion. While it's concerning, it's not life-threatening.
I'm relieved to hear that. How long will it take for him to recover?
Recovery time varies, but most patients show improvement within a few weeks. Complete healing might take longer. We'll need to monitor him for any persistent symptoms like severe headaches, dizziness, or confusion.
What about his memory problems? He's been forgetting things lately.
Memory issues are common after a concussion. It's part of the healing process. Most people regain their memory over time. We can provide strategies to help him manage his memory challenges.
What about returning to work? He has a physically demanding job.
It's crucial to prioritize rest during the initial recovery phase. Once he's symptom-free, we can gradually increase physical activity. We'll need to assess his ability to handle job-related stress and demands before giving him a clearance to return to work. Now look at question 27. You hear a pharmacist talking to a patient called Mihira. Now read the question.
Mihira, choosing the right sunscreen can be overwhelming. Let's break it down. The most important factor is the SPF, or sun protection factor. This number indicates how long the sunscreen protects you from UVB rays, which cause sunburn. However, SPF doesn't fully protect against UVA rays, which contribute to premature aging and skin cancer.
So, I need a sunscreen with both UVA and UVB protection?
Exactly. Look for broad-spectrum sunscreen on the label. Also, consider the water-resistant factor, especially if you're going swimming or sweating. Remember, no sunscreen offers complete protection, so it's essential to reapply every 2 hours, or more frequently if you're swimming or sweating.
What about my skin type? I have sensitive skin.
For sensitive skin, opt for mineral sunscreens with zinc oxide or titanium dioxide. They're less likely to cause irritation. Avoid fragrances and chemical additives. And always do a patch test before applying sunscreen all over.
Now look at question 28. You hear a head nurse called Mihira conducting a morning meeting. Now read the question.
All right, nurses, let's address the new tablet system. I know there's been a learning curve. The primary goal of the system is to streamline patient data access and improve efficiency. You can input vital signs, medication administration, and progress notes directly.
What about patient allergies? How do we ensure they're clearly visible?
Excellent question. The allergy information is displayed prominently in red at the top of the patient profile. Also, there's a function to flag severe allergies for quick reference during medication administration.
I'm worried about battery life. What if the tablet dies during a code blue?
We anticipated that. The tablets have extended battery life and can be quickly swapped. In Code Blue, we prioritize paper charts as a backup, but the tablet data will be synced once the emergency is over.
Will there be training for everyone? I'm still struggling with the medication module.
Absolutely. We're rolling out mandatory training sessions next week. There will also be online tutorials and a dedicated help desk. Remember, this system is a tool to enhance patient care, not a hindrance. Let's focus on adapting and utilizing its full potential.
Now look at question 29. You hear a surgeon called Mihira talking to a nurse. Now read the question.
Mihira, I'm concerned about Mr. Paul's progress. His physiotherapy sessions aren't showing the expected improvement in his knee mobility.
That's interesting. Has there been any increase in pain or swelling?
Not really. The pain is manageable, but there seems to be a plateau in his range of motion. I've tried different techniques, but nothing seems to be making a significant difference.
We might need to consider other factors. Has there been any change in his medication or overall health condition?
He's been on the same medication for a while now. His blood pressure is slightly elevated, but that's been managed.
Let's schedule a follow-up appointment to assess him thoroughly. We might need to order some additional tests to rule out any underlying issues. It's possible there's an underlying condition affecting his knee recovery.
That makes sense, Mihira. I'll schedule the appointment. In the meantime, I'll focus on strengthening the muscles around his knee and providing pain relief.
Now look at question 30. You hear an occupational therapist talking to a patient called Mihira. Now read the question. Mihira, choosing the right walking aid depends on several factors, including your specific needs, strength, and balance. A walker provides maximum support but can be less maneuverable indoors. A cane offers less support but is more portable. We can also explore options like crutches or forearm crutches. It's important to try different aids to find the best fit for you.
I'm concerned about relying on a walking aid for a long time. Will it weaken my legs?
That's a common concern. While walking aids offer support, they don't replace physical activity. We'll incorporate exercises to strengthen your legs and improve balance as you use the walking aid. The goal is to gradually reduce your dependence on it over time.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between an ophthalmologist Dr. Mihira and an interviewer. Dr. Mihira, thank you for joining us today. You've been in the news for your pioneering work in the field of ophthalmic surgery, particularly in eye replacement surgery. Could you start by giving us a brief insight into your work and the responsibilities it entails?
Of course. My work as a leading ophthalmic surgeon is multifaceted, to say the least. At its core, my responsibility is to restore vision to patients whose sight has deteriorated due to trauma, disease, or congenital conditions. This includes everything from routine cataract surgeries to more experimental and intricate procedures like full eye replacements. Beyond the operating room, my responsibilities extend into research, overseeing patient trials, and collaborating with interdisciplinary teams to integrate new technologies. The goal is not just to perform surgeries, but to continuously push the boundaries of what we know in ophthalmology, ensuring that we're giving our patients the best possible outcomes.
It sounds like you're involved in a lot of complex work. Speaking of pushing boundaries, Dr. Mihira, what can you tell us about the latest advancements in eye replacement surgery? This field seems to be evolving rapidly.
Yes, you're right. The field is moving faster than ever. The most groundbreaking advancement in eye replacement surgery is the development of artificial biosynthetic eyes. These are not just prosthetics, but integrate with the patient's existing optic nerves and retinal tissues. The technology relies on a hybrid of organic and synthetic materials that allow the eye to function in near-normal conditions. It's different from traditional approaches where we used only artificial structures. With this biosynthetic approach, we aim for patients to regain nearly 60 to 70% of their vision, which was unthinkable a decade ago. Another remarkable development is the use of stem cell technology to regenerate damaged retinal tissues. Combined with advancements in neural interfaces, we're able to simulate signal processing in the brain, which is key to making these procedures successful.
That's fascinating. I imagine that conducting such advanced surgeries requires significant resources. What are the main tools or resources you rely on to perform these surgeries?
The resources we utilize are vast and span across multiple domains. First and foremost, the surgical technology itself has to be state-of-the-art. For instance, we use laser-assisted surgery tools, 3D imaging technologies, and robotic systems that allow for millimeter precision during surgeries. These are crucial in dealing with the sensitive structures of the eye. Beyond the physical tools, we also rely on data. Before any procedure, extensive pre-surgical simulations are done using AI models that predict how a patient's eye will respond to surgery. These predictive models are built from vast databases of previous surgeries and outcomes, enabling us to tailor the procedure to the individual. Additionally, we work closely with biochemical labs to ensure that the materials used for implants, such as biosynthetic cells or engineered tissues, are safe and biocompatible with the patient's unique physiology.
With so many resources at your disposal, how do you ensure a high success rate, particularly with such experimental and cutting-edge techniques?
Ensuring success is about meticulous preparation and patient selection. First, we conduct exhaustive pre-surgical assessments that include everything from genetic tests to advanced imaging of the eye and brain. We want to know exactly what we're working with before we even enter the operating room. Additionally, post-surgical care is just as critical as the surgery itself. Patients are monitored intensively for several weeks after the procedure to catch any complications early on. Another factor is the team. Every surgery involves a cross-disciplinary team: neuroscientists, bioengineers, immunologists, and of course, ophthalmologists. Each team member ensures their respective area is addressed, whether it's ensuring that the optic nerve integration is working or making sure the immune system isn't rejecting the implant. Lastly, ongoing research and data collection helps us refine our techniques over time. It's a continuous learning process.
It certainly sounds complex. Could you elaborate on just how complex these procedures are and what kind of challenges you face during surgery?
The complexity cannot be overstated. First of all, the eye is an extremely delicate organ with countless tiny structures that are all interdependent. Replacing an entire eye or repairing significant damage involves understanding how all these structures interact. The real challenge is that we're not just restoring vision through mechanical means, but also trying to re-establish the brain-eye connection. The optic nerve, for instance, is notoriously difficult to regenerate or repair. Even when you successfully implant an artificial eye, if the brain doesn't recognize or properly process the signals, the surgery fails. Additionally, the surgery is incredibly time-sensitive. A patient's body can start rejecting the synthetic components hours or even minutes after surgery, which is why we need to work quickly and precisely. Immunosuppression is another challenge, as it carries risks of infection or other complications.
It sounds like there are a lot of moving parts. With all these challenges, how well is your department prepared for patient trials? Given the complexity, how do you ensure that the trials are safe and productive?
Preparation is key. Our department has been gearing up for these trials for years, and we've taken every precaution to ensure that they're as safe and productive as possible. First, we have rigorous screening processes in place. Only patients who meet very specific criteria are allowed into the trial, ensuring that the candidates are the ones most likely to benefit from the surgery. We also make sure that they are fully aware of the experimental nature of the procedure, the risks involved, and the long-term follow-ups that will be necessary. Our clinical team is supported by a research wing that is dedicated to monitoring and adjusting the trial as needed, based on real-time data and patient feedback. Additionally, we have partnerships with external experts and institutions to peer review our methods and protocols before they're applied. We're leaving no stone unturned to ensure the trials are not only successful, but also ethically sound.
Now look at Extract 2. Questions 37 to 42. You hear a nurse, Callum Jones, talking about latest advancements in patient care at Mihira Multispeciality Hospital. You now have 90 seconds to read questions 37 to 42.
Good afternoon, esteemed colleagues, staff members, and guests. As we gather today, it's my pleasure to introduce the latest advancements in patient care at Mihira Multi-Speciality Hospital. Over the past few months, significant changes have been implemented to elevate the standards of healthcare delivery. These changes, rooted in our ongoing mission to provide exceptional, holistic care, are aimed at ensuring patient well-being at every touchpoint within our hospital. I want to walk you through the essence of these changes, why they matter, and the profound impact they will have on both our patients and the medical team, including nurses like myself. Mihira Multi-Speciality Hospital stands as a beacon of modern medical practices combined with a patient-first philosophy. What truly sets Mihira apart is our commitment to multidisciplinary care. Patients benefit from a highly collaborative approach, where specialists from various fields come together to create personalized treatment plans. Whether it's cardiology, neurology, oncology, or orthopedics, we bring together the best minds in the industry under one roof. Furthermore, Mihira Multi-Speciality Hospital emphasizes the use of cutting-edge technology, making us pioneers in the implementation of AI-driven diagnostic tools and minimally invasive surgical techniques. Our reputation is built on a foundation of medical expertise, patient-centric approaches, and continuous innovation. However, it's not just our technological prowess or expert panels that make Mihira stand out. It is our deep-rooted culture of compassion, ensuring that every patient feels cared for, not just clinically treated. This dual focus on science and empathy forms the core of Mihira's specialty, creating a unique space where healing is approached holistically. Mihira Multi-Speciality Hospital has recently introduced several key changes to enhance our patient care framework. These transformations, although operational at various levels, are strategically integrated to improve the overall healthcare experience. One of the most impactful changes is the introduction of personalized care pathways. Rather than adopting a one-size-fits-all treatment, we now tailor healthcare plans to meet the unique needs of each patient. This new system brings a level of precision medicine that was previously unattainable. Moreover, we've expanded our patient communication platforms. Patients can now track their treatment progress, medication schedules, and post-operative care remotely through our digital portal. This allows them to stay in direct contact with their healthcare providers, thus reducing unnecessary hospital visits. Additionally, the introduction of patient-centered rounds is a major shift. These rounds now involve patients, their families, and the healthcare team discussing the treatment plan together, fostering a transparent environment. These rounds also prioritize patient dignity and autonomy, allowing them to have a say in their care decisions. Lastly, we have revamped our nursing protocols to ensure continuous education and skills upgrading, which aligns with the hospital's overarching mission to stay ahead in medical practices and patient care. The changes implemented at Mihira Multi-Speciality Hospital are not merely administrative or procedural. They are set to redefine how we perceive patient care altogether. With personalized care pathways, each patient receives treatment tailored to their medical history, genetic makeup, and individual needs. This precision reduces the risk of unnecessary procedures while increasing the likelihood of successful outcomes. Our expanded communication platforms make Mihira Multi-Speciality Hospital more accessible to patients, even from the comfort of their homes. Remote monitoring tools ensure that patients can track their recovery without feeling isolated from the medical team, ultimately enhancing their satisfaction and emotional well-being. Furthermore, the new patient-centered rounds shift the power dynamic in healthcare, enabling patients and their families to play a more active role in the decision-making process. This improves trust and ensures that the care provided aligns with the patient's values and desires. From a nursing perspective, the updated protocols are expected to greatly enhance the quality of patient interaction. Nurses, armed with updated training and real-time feedback from the new digital tools, can provide more responsive, informed, and compassionate care. These changes at Mihira Multi-Speciality Hospital, though ambitious, have all the makings of a successful transformation. First, the move towards personalized medicine is supported by recent trends in healthcare, showing improved outcomes in terms of both patient satisfaction and medical success. By integrating technology with human care, the likelihood of medical errors is also reduced significantly. Our digital platforms provide real-time updates, which ensures any deviations in a patient's condition are addressed promptly. More importantly, the emphasis on transparent communication and patient autonomy resonates with the growing demand for ethical, patient-first healthcare. As patients feel more involved, their adherence to treatment plans improves, leading to better long-term outcomes. The positive feedback from preliminary trials of these changes suggests that Mihira Multi-Speciality Hospital is setting a new standard for excellence in the industry. From a nursing perspective, the changes have been largely welcomed. Nurses at Mihira Multi-Speciality Hospital play a critical role in patient care, and the shift towards patient-centered rounds and enhanced communication platforms enables us to work more closely with both patients and other healthcare professionals. The continuous learning opportunities provided by the new protocols also ensure that we remain at the forefront of our profession, fostering both personal and professional growth. While some adjustments were required during the transition, the majority of nurses feel that these changes give us the tools to provide better care. The technology reduces administrative burdens, allowing us to spend more time attending to patients. Moreover, the greater transparency in patient care plans makes our roles more collaborative and satisfying. While the changes at Mihira Multi-Speciality Hospital have been overwhelmingly positive, there are certain challenges that we must acknowledge. The new digital platforms, while highly efficient, have occasionally posed difficulties for patients who are less tech-savvy. Some older patients, for instance, may struggle to navigate the app or follow digital updates, which can affect the seamlessness of care. Additionally, with the increased involvement of patients and their families in care decisions, some healthcare professionals have noted that managing expectations becomes trickier. Balancing medical expertise with patient preferences can sometimes lead to tensions, especially in complex cases where the best medical course may conflict with a patient's wishes. Going forward, there may be a need for better educational tools for both patients and families to fully understand the implications of their choices.
That is the end of your OET listening test. Now check the answers.